Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit system of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Rachel Colasino, and my guests for today's show are Janice Paquette, Activity Director at Williamstown Commons Nursing and Rehabilitation Center, and Nathan Pichette, Activities Assistant at Williamstown Commons. Welcome to you both.
Thank you.
Thank you very much.
Thank you for being here. So today we're going to discuss animal and pet visitors and the difference that these animals can make for residents and staff living and working at Williamstown Commons. And later in the show we'll be meeting one of these very special animals and her human handler. So I know that you're both animal lovers, so you're here with us because you've been able to see the benefits that animals and pet therapy have had for the residents living at Williamstown Commons. So Janice, let's start with the basics. What is pet therapy?
So the way Williamstown Commons interprets pet therapy is bringing animals into the facility to either live with the residents or to visit. And their purpose is to bring love, companionship, joy, and moments of reminiscing to them.
And so you have animals who come in as visitors, but also who live there?
Yes.
Yes, okay. So Nathan, can you tell me about the animals that you have living at Williamstown Commons?
Well, right now we have a multitude of different animals. We have a pair of guinea pigs that come around and visit the residents every Monday evening. We have 2 fish tanks, one that lives up in our recreation room and another down on our Unit 3, our Alzheimer's unit. We have our current bird, Sunshine, in our rec room that the residents can come and see as well.
Great. And I understand that the guinea pigs have been with you for quite a while, and Mia and Lily are their names?
That's right. How long have they been with us, Janice?
Well, we had Cara and Mia at first. They were siblings, and one passed away, and then we brought Lily into the mix. So I think we've had them probably 3 years.
Okay.
They're still fairly young.
Okay. And I understand that Mia and Lily like to visit the residents on Mondays?
They do very much. We have a multitude of animal lovers at our facility that absolutely love it. Even just seeing the guinea pigs. Maybe they don't want to pet them, but they just want to see them and they're curious. Some residents might think they're rabbits or something like that at first, so it gives me the opportunity to explain what they are. But a lot of residents like to pet them. A few of them like to hold them just right here and just pet them. And there's this real comfort it brings to them.
Sure.
Guinea pigs are often very docile, so there's no fear of being bitten. It's very rare for a guinea pig to bite, so they're just the perfect size to put in somebody's hands or on their lap.
And Nathan, I understand that there are some residents who had never seen guinea pigs before and weren't really sure, like, so they thought they were a rabbit or...
Yeah, there's been multiple times where, I'll be bringing them around. We have like a little enclosure that we sort of put on a cart, and I bring that around, and a resident will look by and goes, "What's that thing?" I've never seen that before, and it gives me a little bit of time to sort of, explain to them, this is a guinea pig. It's very friendly, would you like to pet them, kind of thing, and most often they do.
Great. And I understand that you have a cat living at Williamstown Commons.
We do. We have a foster cat. So it's a special program that we have with Second Chance Animal Center, which is based in Shaftesbury, Vermont. And Second Chance picks one of their cats, brings it to the nursing home, and I work with the shelter to get the cat adopted. And once the cat's adopted, the shelter picks another cat. So the cat has the opportunity to roam our rehab unit after it becomes acclimated to the facility, the setting, and residents can interact with the cat either in the activity room or while it's roaming on the unit. They have the opportunity to have the cat stay with them at night if they would like, and It's a lot of fun.
And how many cats have come through you through Second Chance?
We're up to cat number 40.
Wow, and all of them have been adopted out?
3 were not adopted through the nursing home. They went back into the foster cat or the shelter system because we need the right cat for our setting. Sure. So the shelter tries very hard to pick the right cat, but it is a stressful and not typical setting. So we want it to be successful for everybody, the animal, the shelter, the residents, the staff.
And how long does it usually take the cats to get adopted when they're with you?
We have had a cat arrive and 2 hours later be adopted. And we have had a cat that stayed with us for a full year.
Okay.
And with that cat, I thought the program would end. And I thought, this isn't how I wanted the program to be. But just as the shelter and I were talking about whether we should switch cats and change it up a little bit, an application was put in and successfully approved, and off the cat went to its new home.
So who usually adopts the cats?
It varies. We have employees that have adopted. We have had family members adopt. My sister-in-law adopted one of our cats. We have had people from the community who are aware of the program call and ask what cat we have at the present time, and we have adopted out to people in the community as well.
What about people from your department?
We have not had anybody from the department adopt, and I think we all work very hard to not fall, although we do fall in love with every cat, to not fall in love to the point where we want to adopt. And many of it, for some of us, is because we have multiple cats already, or multiple animals.
For some of us, such as myself, we already have a menagerie of animals at home already, so bringing another animal to the mix would just be far more stressful than the cat really needs.
So the cat who's with you now, what's his name?
It's Cassie, and she has quite a personality. Cassie doesn't spend a lot of time in the activity room, which is home base. That's where the litter pan, the food, and the water is. She often is out on the unit, often in the day room, which is extremely sunny, so I understand why she likes to sleep there. She often is in the rehab gym, just hanging out in the middle of the floor. And sometimes at the end of one of our hallways, where there's often a chair, a window, and also sun shining in.
Every single one of our cats that's come to our facility has found the hiding spot underneath the piano cover. And so more often than not, somebody will come in looking for the cat, and that's the first place I direct them to. Because every single cat I've seen that's come to the facility has eventually decided, that's a safe place, I'm going to hide there.
Great. So, Janice, how did you first start bringing animals into Williamstown Commons? I know you've been there for a while.
I have been there 20 years. So, because I'm an animal lover, it was easy to incorporate animals into the lives of our residents. And I think we've had fish and birds right from the start. But the cat program, I believe, started in 2001. And the guinea pig program maybe 15 years ago or so. And, you know, we've had animals pass away, and then we've had new ones come into the facility.
And so obviously you're very pet friendly.
We are pet friendly, and we encourage family members to bring in their loved ones' animals that they may be caring for a visit. And we've had many people bring in their dogs. We just ask that the dog be leashed, that they be free of fleas, that they have all their shots. And we have had a few people bring in their family cats as well in a carrier, and then we have them close their bedroom door and the cat can come out and visit. But we have had other animals come through.
Tell me about that.
We have had ferrets, which are very lively and very fun to watch. We have had llamas come in. We have had miniature horses come through
Into the building.
into the building. And these animals are used to coming into these kinds of settings. These are animals that are trained to go into libraries and schools and nursing homes to visit and sometimes provide other kinds of therapy.
You had a really great image about the horse who came in to visit. The horse was wearing sneakers?
Yes, because most of nursing homes are tile or linoleum, it's very slippery for the horses. So the horses come in wearing sneakers, and they're often like bright red or blue or yellow. So that's always fun to see because they're very small.
And you had funny stories about residents telling their family members that a llama came into the building and letting the family members know that's absolutely true.
Right, it's really funny when you have a semi-confused resident explaining to their family that there was a llama visiting, and then they turn to the staff and be like, there was a llama visiting. They're absolutely right. Or to be riding in the elevator with the llama or the horses.
So Nathan, before we break and hear a little bit more about Williamstown Commons, what benefits do you see pets provide to patients and residents?
The benefit is unbelievable. We've had some residents who, well, there's one in particular I can think of. We're going to be meeting our therapy dog later on, and we had her visit one of our units, and the resident that I'm thinking of doesn't normally talk much. Sometimes couldn't even remember what he'd had for breakfast. But Maggie would come in and he'd be, Maggie, good dog, would just light up. And this light that our therapy dog and all of our pets bring to our residents' lives is really why we're so enthusiastic about the program and why we started it in the first place.
Thank you. Thank you. So that's a great segue. We're going to learn a little bit more about Williamstown Commons, and when we come back, we're going to meet Maggie, the therapy dog.
In the heart of beautiful and culturally rich Williamstown, Massachusetts, near Williams College and the world-renowned Sterling and Francine Clark Art Institute, Williamstown Commons offers you the best of both worlds. It's a locally run facility staffed by dedicated healthcare professionals from the northern Berkshire area, and it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in Massachusetts. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Williamstown Commons is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Williamstown Commons, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice, and respite care services. We also offer a fully dedicated Alzheimer's unit, providing individualized care, maintaining dignity and the highest quality of life for these residents. We proudly offer a home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Williamstown Commons is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings, and more. Each resident and patient at Williamstown Commons receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Williamstown Commons, we're perfecting the art of superior care. If you or a loved one needs short-term rehab, extra care after a hospital stay, or a nursing supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-458-2111. We look forward to meeting you.
Welcome back. I'm here with Janice Paquette and Nathan Pichette from Williamstown Commons, and we're joined by Lisa O'Brien and Maggie, our therapy dog. Welcome.
Thank you.
Thank you. So I understand that you and Maggie visit Williamstown Commons, and we were talking about that before the break. So I'd like to start with you in terms of what is Therapy Dog International?
Therapy Dog International is a nonprofit volunteer organization that is dedicated to providing therapy dogs to hospitals, nursing homes, and other venues that need therapy dogs. And it's an organization that regulates, tests, and registers them and their handler teams.
Okay. And I understand there are more than 24,000 therapy dog handler teams in the U.S.?
Yes, there are, in the U.S. and Canada.
Okay.
Yes. It's the largest organization for therapy dogs in the United States.
Okay.
Yes.
And so can you tell me about Maggie's visits to Williamstown Commons?
Well, Maggie and I visit Williamstown Commons every Tuesday afternoon, and Nathan greets us when we arrive, and he takes us around to each of the residents that we're going to be visiting that particular day. We go to their rooms and oftentimes go to common rooms. And anyway, Nathan knows everybody pretty much there, so he's a great guide. Yeah.
So Nathan, you would obviously know which residents are dog lovers and which would want to interact with Maggie?
Exactly, and in a few cases, which ones would not. There are some folks that we've had that don't like animals in general, might have some sort of fear of dogs, and for those folks, we try to avoid them only so that they feel more comfortable. But there's also the fact that Maggie comes for about an hour a day. She visits each of the 2 units that she visits for half an hour. And for some of our larger units, we can't always make it to every single person. So we try to bring it to the people who will most benefit from her experience.
And Lisa, how does she interact with the residents there?
Well, oftentimes if they see us coming down the hall, they start calling her name and wanting to pet her. Maggie brings smiles to lots of faces, I notice, definitely. People really enjoy her company.
And so I understand her usual routine is to kind of sniff around and get the lay of the land?
Yes. Typically, I will guide her on her leash. She has a collar on right now and a harness that she needs for working. And I basically lead her to a person, a patient, a resident, and she will smell them a little bit and sometimes kiss them depending on how receptive the person is. And I'll just have her sit next to them, stay next to them, and basically she'll stay until I release her.
So can you tell us, does she have any tricks that she likes to perform?
She has a very short repertoire of tricks, but she likes doing them, and she does things such as sit, stay, give me your paw, high five, she waves, she can do beg, and the residents especially like when she does something that I call be shy.
Can we see some of those tricks today?
Oh, sure. Would you like me to do them now?
Yes.
Yes, okay. Let's see, okay. Should I stand? Or is
Yes.
it- Okay, sit. Okay, give me your paw. Oh, thank you. Wave hi. High five. Do it again. High five. Can you lie down? Oh, lie down. Yes. Be shy. She doesn't have a lot of room, so she may not do it. Come on. Be shy. She's trying. There you go. Did we miss any, Nathan? Oh, yes. We have another trick the residents like. Nathan is the one who started this, and she can wear sunglasses. Okay. Pretty girl. Oh, pretty girl. Let's get the pretty girl. There you go. Yay. Good girl. So there you go.
So Nathan, I understand you have a good story around that, and so I understand that Maggie will stay if you ask her to. How did you first understand to the sunglasses trick?
Well, I noticed Maggie is trained so that when Lisa tells her to stay, Lisa can do whatever she needs to do in the room, and Maggie will stay there and not move. So I had a pair of sunglasses in my pocket at the time, so I was like, let me try something, Lisa. Tell Maggie to stay. So she did, and I took out the sunglasses and put them on, and she just looked just like off in the distance and just cracked a smile.
Lisa, what kind of training did Maggie go through?
When Maggie was about 12 weeks old, we enrolled her in puppy socialization classes. And that basically was just getting her used to other dogs and people. And then when she was almost a year old, we got involved with Canine Good Citizen classes, which she needed to become a therapy dog. And she completed that, and that's mostly to train her for good manners. So such things as she has to learn to sit, to stay, to leave it. And then for Therapy Dog International, she needed to pass Canine Good Citizen, and then Therapy Dog International takes it one step farther, and the dogs are trained to be comfortable around people, loud noises, hospital equipment, things like that, be okay in strange situations. And also they're tested for their temperament. They have to have a very calm, even temperament around people in medical settings, say, like that.
And we heard before the break from Nathan about changes that he sees in residents when Maggie is around. Do you see changes in residents too?
I do, yes. Like I said before, it brings a smile to their face, and oftentimes they might reminisce about pets that they've had in their lifetime, and they're happy to do that. I know one gentleman who can't move very much, and he seems a little agitated, but when he sees Maggie, he completely calms, and his eyes never leave her.
That's great. So I understand too that studies have shown that petting a dog is great for blood pressure and for stress levels.
Yes, they've done excuse me, yes. Yeah, they've done studies that show it does really help relieve stress and lower your blood pressure. So I feel like she does that for me too.
So Janice, what about you? Do you notice changes in residents or even staff after Maggie's visits?
Absolutely. I think sometimes we forget it's Tuesday afternoon, and then all of a sudden they appear. It's like, oh, it's Tuesday, yay! And Maggie's quite a presence. So when she's walking down the hall, she draws everybody's attention, staff as well, and she seems to know which staff know dogs well and where dogs like to be petted the most. So she'll go right to those people so that they can do the ear rub and maybe the near the tail area. Her little massage time.
And I understand too that her size is great for the residents too.
It's a perfect size. We've had other dogs come through, and some are smaller, and you end up having to pick them up for every resident and sometimes hold in your arms for the entire visit, which is quite exhausting. And so her head is just at the right level if somebody's in bed, that she can be petted on her head. But we also have some times where she's come up with her paws. You've had her put her paws up.
Yes, she'll
too,
do
so
that
they can-
occasionally. Yes, yes.
So that works out really
Yes.
well, and perfect size for wheelchairs as well. They don't have to bend over.
Right.
We have one resident in particular who's in a power chair and normally doesn't get to pet dogs that come through because they're too small and his chair is up too high. But his chair can go up and down, and his chair can go down just enough, and Maggie's just tall enough so that he gets to pet her. And it makes his day.
That's great.
Yeah.
That's great. Well, thank you all for being here. Thank you, Maggie, for being here.
You're welcome.
This has been InfoSource, a presentation of Berkshire Healthcare Systems.